Hello, it's Dr. Rhonda Johnson, and today is Tuesday, December 29th, 2020. And today I'm going to be discussing advocacy and support for you or your loved one if someone gets sick and has to go to the emergency room or if they're hospitalized with COVID-19. And I'm doing this in memory of all the fallen healthcare heroes and in particular, Dr. Susan Moore. But I want to start by saying think and plan in advance. We know that COVID 19 is on the rise. We're in a surge that hasn't ended yet, and many people can be successfully treated at home. However, if you get COVID, it pays to hope for the best, but prepare and be prepared for the worst. Now, I've already videotaped a message on having a emergency kit, and I will include that link in this post. We know that yesterday the TSA screened 1.3 million people at the airports. Hospitals are bracing for an impact. There will not be enough beds and staff to treat all these sick patients with COVID in the next 2 to 4 weeks. And hospitals are going to have to make some difficult decisions about who gets what treatment. So again, the more you can do in advance to be prepared, hopefully the better outcome you'll have. So what should you do? First things, I want you to know key information around when your COVID symptoms started or the family member, when the test was positive, if you've had a test, if there are any chronic health conditions, what medications the person may be on at home, the day the symptoms start to worsen. Write all of this down and have this prepared. It won't hurt to have some of this done in advance, like a list of all the medications that the patient has been taking when they're not so sick in this illness. The second important point I want to remind people is that there are 2 monoclonal antibody therapies that may work against the SARS-CoV-2 virus. They again have been approved under emergency use authorization by the FDA. But again, if they're given early for people who have high risk for COVID complications, they have their greatest likelihood of working early in the course of the infection. And they are given in an outpatient setting like the emergency room. So you don't want to wait too late. If you have confirmed COVID and you know that you're at risk for complications, then talk to your doctor about if these monoclonal antibody therapies may be right for you. Now, if your loved one or yourself is getting worse with COVID and you think they need to go to the hospital, you've talked to your doctor, or they're just not doing well and you're concerned, one important thing that I hope you will remember is have a cell phone and a cell phone charger with that person who is going to the hospital. Bring a personal ID and insurance card because you won't be able to stay at the hospital with them. You may not even be able to get past the emergency room. So make sure they have their cell phone and their charger. Now, no one likes to think about this, but you need to have these discussions in advance with your family member or, for yourself and have advanced directives. If your health situation worsens, what is important to you? Do you want full treatment? Do you want to go on a ventilator? Do you want everything done? Who is going to make these decisions for you? How much does your family or your friends know about your priorities and your wishes? And again, who makes a decision. So for family members, if your loved one gets hospitalized, you want to be able to be an advocate for them. So make sure you have a notebook or a journal. Write everything down. The name of the nurse who calls you, the name of the doctor, the name of the room they're in, the floor, the bed number. Ask the staff when is the best time to call for updates. We know they're going to be busy taking care of way too many patients with COVID. Or ask them what is their protocol for notifying the family. Write down all the names of the medications that are being given to the patient, because there are some medications that can help depending on the phase of illness and the timing. Again, these medications work in certain phases of this disease. So for example, remdesivir is an antiviral agent and is currently the only drug that is approved by the FDA for the treatment of COVID-19. And it is recommended for hospitalized patients who require supplemental oxygen, but it's not routinely recommended for COVID patients who have to go on the ventilator because it just hasn't shown a lot of benefit at this advanced stage of the disease. There's another drug, a steroid, dexamethasone, which has been shown to improve survival in hospitalized patients who require supplemental oxygen or mechanical ventilation, with the greatest effect observed in people who are on the ventilator. Now, I want you to remember, this advice that I'm giving you is just advice. There is no substitute for advice from your doctor or advice of the treating physicians who are there at the hospital treating patients who are critically ill. I've said many times, the best COVID-19 infection is the one that never happens. Please, in this surge, do everything you can to take preventive measures to keep from getting infected with this virus. We just don't know who's going to go on to have mild disease and who's going to go on to have life-threatening disease. Again, this is Dr. Rhonda Johnson. I hope this has been helpful. My views are my own, and I will provide the link to a previously recorded message about having emergency supplies for people with COVID who are going to be cared for at home. Stay safe. Please wear your mask. Stay 6 feet apart. Avoid indoor crowded places. Folks, consider skipping those New Year's Eve parties. Now more than ever. Just 1 year, and then we'll all party next year. Have a blessed day.